Robotic surgery is not what some people might think. It's not autonomous. The robot isn't performing the surgery itself. It's actually called robot-assisted surgery. You could say the robot is performing the surgery, but it's really the surgeon who's doing it.
Well, you can't exactly buy surgical robots at the grocery store. So how did Schrader actually define that it was something people needed? His own background in sales.
R2 Surgical is a secondhand surgical robot reseller based out of Toledo, Ohio. We help hospitals in the United States and around the world implement surgical robotic programs at their hospital at affordable prices.
And so surgeons around the world can access gently used equipment, and these procedures are often life-changing.
About 6 years ago, so my other company is called Medco Blue, where we resell secondhand diagnostic imaging equipment like MRIs and CTs. And at that time, I had a couple hospital customers come up to me and ask if we had any surgical robots. They had one option, which was to purchase a brand new robot for on average $2 million. So I thought, well, let me see what I can do. That's where I got the idea to find robots in the secondhand world and then offer it to our customers.
So how does R2 Surgical make sure they're up to code? I mean, these are robots helping to operate on humans after all.
After you've broken down, I think, the barrier of what the robot is, that the surgeon's the one actually using it, it becomes a little bit easier to explain that it's a piece of equipment. Any system that we might acquire from a hospital, let's say here in the United States, we make sure that we put it through a very extensive checks and balances, and with the proper maintenance, it can keep going for a long time. The way that we are different is that we're not providing the level of service necessarily that the manufacturer would. Unfortunately, in the manufacturer Intuitive Surgical, they don't work in all areas of the world across the globe, and that's where we fill the need. So if we've helped a hospital in Turkey install their system and we've coached them through the process on how to use it, we can also instruct them on how to maintain the system so that it keeps functioning as it should. There's a simulator backpack attached to the back of this console right now. So it's acting as, it can have different games on it. You can do some skills and practice and just kind of refine your skills as a surgeon. This is what a surgeon would do.
And exactly what type of surgeries do the robots assist with?
The Da Vinci robots, they perform soft tissue procedures, urology, gynecology, and then other types of robots such as Stryker Mako does orthopedics types procedures, hips, knees, joints. There's more than just those, but the Johnson & Johnson, they have something called the Auris Monarch, and that can do different types of bronchoscopy procedures as well.
And in addition to costs, R2 Surgical says the environment is an important factor to them as well. Hospitals have to pay for waste and parts removal and typically contribute 5 million tons of waste per year.
You are actually in sales for R2 Surgical, but you also are into sustainability. Can you explain a little bit about that, Tess?
We thought it would be good to implement the instrumentation recycling program. The instruments can only last 10 lives. So what we do is we stop in at hospitals, drop our bins off in the decontam rooms or ORs, and do bi-weekly or weekly pickups. This typically would be just thrown away, but they're put into the bins and we recycle them properly.
The go-to fear is that robots could take jobs, but as founder Schrader says, they're meant to assist in ways humans cannot, helping make and keep pets and people physically well.
Instead of one large incision, it's smaller, multiple tiny ones that heal a lot faster. And the whole goal of the minimally invasive surgery provided by the robots is so that the patient can heal a lot faster. That's how they're contributing to, I guess, the overall wellness of patients.